This is Walt Fritz from Foundations in Manual Therapy Seminars. Just want to talk to you a little bit today about the hyoid bone. Boy, oh boy, we get a lot of questions about the hyoid bone, the muscular attachment, the purpose of it, etc. But there's one thing that really strikes me is I think most of our exposure to the hyoid is possibly from, anatomy textbooks or those little plastic ones. I carry a plastic one to all my seminars, and we talk about the hyoid bone, etc. But have you ever really seen an actual human hyoid dissected out? We're going to take a close look at the one here I've got on my actual human skeleton in a moment. But the reason I bring this up is there's a paper that was published in 2015 by a lead author by the last name of Fisher, who really throws some water on our concepts of an adult hyoid bone. And, basically they're saying that not all adults have a fused hyoid, that it's basically continuing to be three bones as it was when the child was born and as an infant, which is shocking it was shocking to me when I first found that out. And it's certainly surprising to a lot of seasoned clinicians who, we have this assumption that the hyoid is a bone. But, the statistics say that the average age of fusion of the hyoid bone from three bones to one bone is between age 20 and 50. That's according to Fisher's study. I'm going to link the how to find this paper if you're interested in it. And should that be a concern of ours? There's some people who say that the surrounding structure of the hyoid bone is so robust that there's not a danger of us, messing with those pseudo joints, if you will, if the bone is not fused. But once, I was exposed to a video that showed an actual human hyoid bone and somebody squeezing it like this. And basically you saw a little bit of joint dislocation, if you will, here and here in that adult hyoid. And that was a little disturbing up here. And while I agree that we're set up so that our structure is supportive, once you see that video, you can't unsee it. So in my skeleton here, now this is, like I said, this is an actual human skeleton. The hyoid is a reality in this person. It's not that what I've always seen is a thicker plastic hyoid to, how we learn from. But when you really take a look at this, those posterior horns are really quite slender. Now, granted, the wire is covering that a little bit, but you can envision that with grasping it, as many of us do with laryngeal evaluation, hyoid evaluation, and possibly even manipulation, that's not the most robust bone in the human body by any means. I'm not trying to create a sense of fear around working with the hyoid bone, but I think it should, seeing this actual human hyoid, and then reading the study that I'm going to be posting with this video, maybe just be a little bit more respectful of it. And I think it comes down to philosophy too. Do we really need to be aggressive with hyolaryngeal manipulations, hyolaryngeal manual therapy? Can we accomplish what some people do with aggressiveness or more squeezing, that sort of thing? Can we accomplish that in a lighter, more tolerated way that we don't risk harm, damage, or the fear of damage up here? I think that's important with our patients, to allow them a locus of control in our interventions and not just have them hold on to the chair or massage table as we crank on their larynxes and crank on their hyoids. So I hope you keep in mind this image right here, how really delicate that hyoid bone is, how with the wrong kind of intervention, we may damage that. And again, once you see this, I don't think you can unsee it.